What's interesting in that patient is that he has a very subtle finding that leads to the diagnosis. And this finding is this. This is a 38-year-old male from Ukraine who came with blurry vision in both eyes. And he says he has macular degeneration in the right eye, very poor vision on the left. He says he's healthy, is on no medication. The entrance testing, really the thing that stand out was the poor visual acuity on the left eye. You can see count finger. And I did the pinhole to differentiate, well, is it disease or is it refraction? Didn't change anything. So there is some disease that is causing count finger visual acuity. Anterior segment was normal, and then we look at the back, and you can see is the massive scar. Now here's a question for you. Is the scar under or above the retina? There's one simple thing. If you find it, you know if it's on top or below. Look at the blood vessels. If you see the blood vessels, it's below. If it's on top, you're not going to see the blood vessel. What's interesting in that patient is that he has a very subtle finding that leads to the diagnosis. And this finding is this. You see here? There's like little lines. Now, if you look here, you might think it's a blood vessel, right? And if you look here, these are not blood vessels. For example, let's see here, this thing here. This is not a blood vessel. This is a crack within what we call Bruch's membrane. Bruch's membrane is a layer just below the retina, and it separates the retina from the choroid. It's kind of like the barrier, and it prevents them from communicating too much. Now, once you see those lines, you're like, that reminds me of a condition, because these lines are called angioid streaks. And we know that angioid streaks are specifically associated with 5 conditions that we remember as Pepsi, right? And within those conditions, the number one, the P on top, the pseudoxanthoma, is 95% of all of 5. So most likely this patient has this condition. So to confirm my diagnosis, when the patient came back from dilation, I say, can I see your skin? And here it is. He has the folds, those weird folds on the skin. Pseudoxanthoma, by the way, it's a genetic condition, and it affects the connective tissue, on the collagen problem, right? And well, they have problems everywhere, including in the eye, where you see those cracks in the membrane. Those cracks eventually, because they are an opening between the retina and the choroid, they allow neovascularization to grow under the retina. They bleed, and at the end, well, it results in a scar. All this mess just results in a scar and count finger vision. Now, he needs to be really careful for the other eye. At least now we know what's the problem. So he's going to follow really well the right eye, because as soon as we see neovascularization, he needs an injection to stop it, because otherwise he's going to end up like this too.